In fact, one of few friends, they have to leave for sightseeing. So I just asked them, you better listen this one because I want to convince neurointerventionists from Spain to start this thing in their country as well, because it's quite rewarding in my experience. General Sahib is sitting here, we were discussed this thing during the lunch. So I also try to convince him, this is the best choice for the cervical disc, where even surgeons scared doing surgery on those. So as you could see from the title, again the same terminology which we're using for other part of the treatment with ozone. It's a minimally invasive technique have developed as alternate treatment to surgical intervention. I think this word is quite, a sentence is quite important for the cervical, because in cervical it's quite scary for the family, for the patient, for the even doctor who's doing it. Sometimes doctor has to tell, look, it's very difficult and it's my first patient. The patient also already scared, and when you say it's my first patient, it's too much. Anyhow, so again the same old slide, chemodiscolysis. I think considering the all percutaneous, this is the not only safest, I think this is the best choice to treat the cervical disc. So this is the approach. I just shortening the whole slides. Cervical disc, we have to go from anterolateral from the right, always from right. Even the disc bulge is on the left, but we have to go from the right. We just make a local spray. We don't give even anesthesia in this case. 22 gauge needle, and we just make a local spray. Before, during the local spray, we select the site where we have to go. Sometimes it's quite confusing, long, short-sighted neck or long-sighted, and the fatigue person to accept to go into the disc. So sometimes we have to localize in two ways. Once you are in the disc, if you feel you are in another disc, so I just keep that needle there and I put another needle where we are supposed to. So it could be a landmark to get a better place. Again, the ozone, because this is important. If it is clear to you people, for ozone in discal treatment, nucleus pulposus is the best place, the only area where it acts. Difference between cervical and lumbar disc. In lumbar disc, when we come into the periganglionic place, we give 1 cc some ozone, 2-3 cc, of even 4 cc, and along with the because ozone is slightly irritative, it's slightly painful, as Umair was telling in the other joint, shoulders and fibromyalgia. It is slightly painful because it's a potential space, it's not a normal local space. Here it touches the nerve, so we give 1 cc local and 1 cc steroid after the ozone in the periganglionic region. So that could help to make it symptom-free. This is for the lumbar, not in cervical. In cervical, we just go intradiscal, nothing else. And definitely, I just rely on MRI. And the most important, another most important, MRI, when you treat lumbar spine, you can wait even, you can have that MRI of 1 year or 8 months, it's okay. But in cervical, I made a blunder a few years back, about 8-9 years back. One of the orthopedic surgeon, his father was treated. They had an old scan of 4 or 5 months, and it's a significant disc bulge. Just to save his money, believe me, I said, we'll do it. He was a free case, it's not an issue. Unfortunately, couldn't get relieved. In fact, he had to go for surgery, and after surgery he died. So the all burden was on me. I'm the cause for it. But anyhow, that is a long story, and thanks God, once your conscience is clear and you are clear what I'm doing it. So since then, I am relying just a 6 to 8 week old CT MRI, not more than this, in cervical disc. Or again, the same, which is for the lumbar, hair, motor loss. If one is already motor loss, calcified disc, pregnancy, of course, it's a radiation-based imaging, so we don't have to do it. Low cost, I could say low cost, but generally having one session which is equal to 15 session of lumbar spine, getting that much radiations, so I believe could say low, but it's slightly expensive as to the lumbar spine in my practice. And the other things are the same. Just keep it for 1-2 hours, and they have to start their normal working, but with 3 precautions, very interesting precautions, because the people don't understand. Then we have to talk in over local language. One is don't take the avoid weightlifting, and use soft collar when mobile. And when you have to shake hand, so the guy who can't understand Urdu or our language, so I usually say कि कमीनों की तरह हाथ मिलाओ, सिर्फ ज़ोर से बस हाथ ही टच करना, मिला ज़ोर से नहीं मिलाना. और यहाँ now the new thing is coming up, Corona style, you just have to put it on your chest. So try to avoid 2-3 things. So it's not a big precautions. CT guided, of course, not doing it. Angiofluoro. Intradiscal. In this paravertebral, yes, we do it. Paravertebral, sometimes we have to do, because usually fibromyalgia is not common with the cervical disc. Fatigue syndrome, that could be possibility. Use of collars can produce paravertebral fatigue or mimic like a fibromyalgia. But generally fibromyalgia related to the disc is most common is with the L5S1. So that's why then we keep it, what we do it, we prone the patients and we inject according to the disc levels. Under angiofluoro, not going into this, not in the periganglion, just paravertebral planes. Usually just single disc prolapse, I do it. There are few patients, one of the Janasa, one is old, he died now. He died, I did his case at the age of 84, he's a retired brigadier. So he asked me, son, you have to do it. He father of 3 colonels. तो वो फिर किया था, it's a long time ago. So he was remained strong advocate for many years till he was alive. So that I did few cases in that way, but generally I do just single disc bulge prolapse. Session in cervical disc, this is the blessing. We maximum we do 1 or 2. By and large, in 95% we just do 1 session. Direct, as I've told you, we don't periganglionic, we don't go from behind, we go from here, anterolateral approach, and direct, and then we come shrinkage. Results, you could see most of, I mean, this is the, you could say it's a practical or theoretical, whatever you call it, but the results are really good. 50% means almost 100% recovery. 25% or 5% had sufficient improvement and went for insufficient improvement, went for surgery. As I've told you, it has no side effect, no infection, nothing. We are distorting anything. The 10% cases never turned up, and generally this is over practice in our setup. Once the patient have a treatment, they never turn up for follow-up generally. But some people, the only people follow up who have symptoms, by and large. Result you could see, as I've told you, 50, 20 and all this. So conclusion, this have mentioned intradiscal and paravertebral injection of ozone for herniated cervical disc revolutionized the percutaneous approach to nerve root disease, making it safer, cheaper and easier to repeat than treatment currently in use. Repeatedly I don't do it. As I've told you, maximum 2 times I do it. There is, out of my 6,000 cases, just hardly 6 or 10 patients whom we could say we had repeated, and yes, there is a failure, as I mentioned before, 5 to 10%, that is there. Here you could see from the picture, no need to explain what I've done it and what was before. There is a significant disc bulge and there was a signal change in the cord. And of course, I mean, refused to go for surgery. The family approached me, and you could see before and after the 6 months. There is a shrinkage of the disc, signal change in the cord, which was already there. It remained there, but you could see the size of the cord is increased. So this is quite obvious, and C3-4 is one of the difficult place even for the surgery, but here we can more or less with experience easily we can approach. Here you could see the multiple 2 discs. And these are actual my cases. It's not a stolen or bookish picture. So here you could see the before treatment, there were 2 discs, and after the treatment, you could see the both disc has gone. So we did 2 sessions, I can't call it 2 sessions, 1 session each. So they are one of, again, the guy is still, he was chairman NRC and he was a journal. He was strong, he said I can tolerate it. So I did just 1 session in 2, but not this patient, it's another one. So very rarely I do together, but generally I do per session 1 disc. Here, this is a very interesting case. This case, even in my brochure, this guy was drunk, he was 28 years, and fell from the roof, and it's a more or less quadriplegic look. The family refused to go for surgery, and somehow they able to approach me. It's in 208 or 9 something. Here you could see, I said, I will try. His mother was saying, please do it something. So I said, I can try it. Believe me, I was not comfortable or not confident enough to get that much good effect which you could see on the imaging. And now, after that much years, he is married, slightly crippled in moving and doing a normal life. He's life insurance guy or whatever it is, I don't know. But it's quite obvious before and after. And usually we repeat MRI after 6 to 8 weeks. Again, you could see, these are the so fascinating results. Even I don't have to tell you which disc is. You could see there is 4-5 before and after 4-5 the treatment. So that much difference, you can't get it without surgery except in a zone. Here again, the most difficult place again between the C3-4, significant disc bulge, although it's a slightly zoomed, but still you could see there is an opening of the cord. Of course, the signal change, nobody can change signal even after the surgery. So here you could see there is a significant improvement. Again, it's a vice versa. On the right side is before, both are I think before 5-6, and after this one 5-6. What else we can get a result from this ozone? Non-invasive, safe, 1 session by and large, and you're getting a result after 4 to 6 weeks. No need for the surgery. So to me, I feel this is the great breakthrough, having this ozone treatment in cervical issues. So this was my paper published back in 19 or 18, 19. I always put, whenever I write that sort of a paper with a Marco Linardi, because he was teacher, he was my teacher and like a father to me from Bologna, and very encouraging. That's why I encourage my youngsters to be in this field. Atif is here, who's made a tilawat in the morning. He's a part of Hamidullah. He was here, he's here. He's from Egypt, Afghanistan, and now he's going to be doing better than me as well in future, inshallah. So after the publishing this paper in neurosurgical journal, so it is more encouraging for me and the guys, the doctor, physicians, neurologists who are sending me the patient, they are more, have a confidence in me. Thank you very much. So it's a particular for the Spanish guys because they have to move around, so I don't want to take much time. We'll discuss later. Okay, there are so many other speakers, I think has to come. Thank you very much. Thank you very
much. Thank you, sir. Our next speaker is Dr. Karen. She is working in rehab medicine in North Italy. She will talk about ozone outcome in bad